Welcome to the deep dive. Today, we're plunging into something that quite literally keeps us all going, heart health.
It's absolutely fundamental, isn't it?
Yeah.
But yeah, it's so easy to misunderstand or, overlook.
Totally. So our mission here really is to distill the crucial insights from this really fascinating source we came across.
Okay.
It's a detailed conversation between a doctor and patient titled Heart to Heart, Understanding Heart Diseases.
Ah, okay. Sounds interesting. What makes it stand out?
Well, it's the personal story in it. You follow this
Yeah.
patient's journey, from kind of brushing off some subtle symptoms
Right.
to actually facing a serious diagnosis, getting their head around the disease, and then the road to recovery.
Wow, okay. That sounds really compelling.
It is. So as we dive in, we're basically asking, what are heart diseases, really, beyond the usual labels?
Yeah.
And what are those signals, the ones we often miss, that our bodies might be sending?
Good question.
And crucially, what proactive steps can we genuinely take for prevention and treatment? Okay, let's unpack this.
Yeah, let's do that. And I think what's immediately relevant for you listening in is just how many people might be walking around with undiagnosed heart conditions.
Mm,
Precisely because, like you said, the symptoms are just so varied, they can easily seem like, I don't know, a dozen other things,
yeah,
minor
shut up.
stuff.
Things you just ignore.
Exactly. So this deep dive, it's really meant to be a shortcut for you
Yeah.
to grasp the critical bits of heart health.
Get the essential knowledge.
Yeah, get it quickly, but, thoroughly,
Yeah.
without feeling like you're drowning in medical jargon.
Okay.
We'll explore everything from the basics of different heart diseases, maybe some surprising risk factors you haven't thought about,
Oh, interesting.
and even the latest treatment approaches.
Mm-hmm.
And it's all drawn directly from this conversation, this heart-to-heart source between the doctor, Dr. Smith, and her patient, Mr. John Anderson.
Great. So let's start right there at the beginning. In this conversation, how did Dr. Smith actually define heart diseases? What were the key types she pointed out?
Well, the source makes it clear. Heart disease isn't just one thing. It's like a big umbrella term, a whole spectrum of conditions affecting the heart.
Okay.
So think of coronary artery disease. That's kind of the classic clogged pipes situation. The arteries supplying blood to the heart muscle get narrowed by plaque.
Got it.
Then there's heart failure. Now, this doesn't mean the heart stops.
Right, that's a common misconception.
Exactly. It means the heart muscle is weakened, struggling to pump blood efficiently around the body.
Okay, what else?
Arrhythmias. That's basically irregular heartbeats. Too fast, too slow, just erratic.
Mm-hmm.
And you can also have problems with the heart valves. They're like the little one-way doors inside the heart, making sure blood flows correctly. If they don't open or close right, that's a problem too.
Okay, so several distinct types.
Yeah. And Mr. John Anderson, the patient we mentioned,
Right.
his story really highlights something so many people experience, that initial dismissal of, mild symptoms.
You did that.
He did, like countless others, apparently. He initially waved away his chest discomfort, bit of shortness of breath, just put it down to stress,
Ah, the classic. It's just stress.
the classic. But then when he started getting these dizzy spells,
Mhm.
during just simple everyday activities, that's when the alarm bells finally started ringing for him.
Wow. That's quite a wake-up call and a really poignant reminder, isn't it? How easily we can ignore those little nudges from our body.
Definitely.
But with symptoms like fatigue or dizziness being so general, how can you tell the difference between, say, just being run down and something potentially serious? Did Dr. Smith give any guidance on that, when to really worry?
That's the tricky part. And what Dr. Smith apparently highlighted isn't just the variety of symptoms, but how insidious they can be.
Insidious. How so?
Well, many are just so subtle. Like you said, that persistent fatigue, maybe some swelling in your legs or ankles, or even just feeling slightly dizzy now and then.
Yeah, things you could easily explain away.
Exactly. Our brains are almost wired to rationalize them. Oh, I'm just getting older, or I worked too hard, didn't sleep well.
Right. Creates a dangerous blind spot.
A huge blind spot, even for people who think they're pretty health conscious.
Ah.
In John's case, it showed clearly these seemingly minor things can be critical warning signals.
So what's the key then?
The doctor emphasized looking for patterns or changes. Is a symptom new? Is it getting worse? Is it actually interfering with your daily life?
Ah, okay. So context matters.
Hugely. If it checks those boxes, it warrants getting checked out professionally.
Ew.
It's like our bodies are sending up a little smoke signal.
And we're just waving it away thinking someone's having a barbecue.
Ah, Yeah, exactly that. A perfect analogy.
Absolutely. And John himself, in the source, he asked, right, so these mild symptoms were really my heart sending me signals.
He does. And the doctor's confirmation just, boom, underscores how vital that awareness is.
Which leads us right into the next big piece, risk factors, common culprits, and prevention.
Mr. Anderson, the patient, he was quite open in the source about his lifestyle before the diagnosis, wasn't he? What did his story tell us about how these risk factors kind of work together?
Oh, absolutely. His pre-diagnosis life is a really compelling example of how these things often snowball. They don't just exist in isolation.
Right, they feed off each other.
Exactly. A dangerous feedback loop. He admitted exercise wasn't really a priority for him. His diet, heavy on processed foods.
You don't know your story for many.
Very. Plus, smoking was an occasional habit, and he wasn't really managing his stress levels. And then there was family history.
Genetics.
Yeah, family history of heart disease, which he admitted he never thought much about.
Wow. So a combination.
A potent combination. And the source points out something interesting. A high-stress lifestyle often drives those poor dietary choices and makes you less likely to be active.
That makes sense. Too stressed to cook, grab takeout. Too tired to exercise. Precisely.
Yeah.
So when you have these factors, the high-fat diet, not moving enough, smoking, chronic stress, plus maybe that genetic predisposition, all left unchecked.
Yeah.
They basically force the heart to work way harder than it should. And that leads directly to things like high blood pressure, high cholesterol, maybe even diabetes.
So those conditions are like the result of the strain.
They're physiological stressors themselves, yeah.
Yeah.
They're not just labels on a chart. They actively accelerate the damage to your cardiovascular system.
That's definitely sobering. But I guess it also highlights where we do have some control, right? Lifestyle changes.
Yes.
Although, we say lifestyle changes like it's easy.
No,
But actually doing them and sticking with them, that's the hard part.
it really is. Sustaining them is key.
Did the source get into practical ways to keep those changes going,
Yeah.
especially after a diagnosis like Mr. Anderson's? And how do these changes actually help the heart?
That's a great point. Knowing what to do is one thing. How to make it stick is another challenge entirely.
Right.
The source does emphasize focusing on heart-friendly foods, fruits, veggies, whole grains, lean proteins. Not just because they're healthy in general,
Yeah.
but because they specifically help reduce inflammation in the body and manage cholesterol levels. They actively support the health of your arteries. It's about fueling your heart's resilience.
Okay, so it's targeted fuel. What about exercise?
For exercise, it stresses that even moderate activity makes a big difference. Things like brisk walking, swimming,
For me,
yoga, just aiming for about 30 minutes most days.
doesn't sound overwhelming when you put it like that.
No, and physiologically it does wonders. Strengthens the heart muscle itself, improves blood circulation, and of course, quitting smoking, that's just non-negotiable.
Because
Because tobacco directly damages blood vessels. It just pours gasoline on the fire when it comes to heart disease risk.
got it. So diet, exercise, no smoking, anything else on the prevention side?
Yes, regular health screenings, absolutely vital, the source says, especially if you have that family history.
Like checking blood pressure.
It's exactly blood pressure, cholesterol levels, blood sugar, or glucose. Getting those checked routinely lets you catch things early.
Which is key.
Absolutely crucial for preventing problems from getting worse, or for starting treatment effectively if needed. And one more thing, stress reduction.
Ah, yes, the stress factor again.
Yeah, techniques like mindfulness, meditation, even just hobbies you enjoy, because chronic stress really does feed into those unhealthy habits and conditions.
Makes sense. And these proactive screenings, they were exactly what flagged Mr. Anderson's issues, right? Which led to diagnosis and treatment.
That's right. His story highlighted their importance. He had blockages in his arteries, which needed intervention.
So how did the source describe that diagnostic journey? And what about treatment? It mentioned 3 pillars.
Yeah, the diagnostic path usually starts with non-invasive stuff. Blood tests, an ECG, that's the electrocardiogram, gives a snapshot of the heart's electrical activity.
Okay.
Or maybe stress tests, where they see how your heart handles exertion.
Right, on a treadmill sometimes.
Often, yeah. If those show any potential issues, then they might move to more advanced imaging. Things like an echocardiogram.
That's the ultrasound for the heart.
Exactly. Uses sound waves to create pictures. Or maybe a CT angiogram, which gives a detailed map of the blood vessels. Mr. Anderson's blockages were found through steps like these.
Okay. And the treatment pillars.
Right, 3 core pillars according to the source. First, foundational really, are those lifestyle modifications we just talked about. Diet and exercise were huge for Mr. Anderson's recovery.
Pillar 1. Lifestyle.
Pillar 2, medication. Things like statins, they work to lower that harmful cholesterol, stop plaque building up.
Okay.
Then maybe beta blockers, which help slow the heart rate, relax blood vessels, just ease the heart's overall workload.
Makes sense.
And sometimes aspirin, maybe low dose, to thin the blood slightly and reduce clotting risk. These aren't just quick fixes, they manage the underlying physiology.
Got it. Pillar 2, meds. And the third?
Pillar 3 is for more severe cases, surgical or procedural interventions. Mr. Anderson, for example, had an angioplasty.
Right, you mentioned that. With the balloon.
Exactly. They insert a tiny balloon to physically open up those blocked arteries. And often, they'll place a small mesh tube called a stent to help keep the artery open. It basically restores blood flow.
That sounds pretty advanced.
It is. And it's incredible to hear him say in the source that he thought surgery would be terrifying.
Yeah.
But he was actually surprised how minimally invasive his procedure felt.
That's a really important point. Technology in cardiology has come such a long way.
Immense advances, making these procedures much safer, and recovery times often way faster than people might imagine.
But the doctor also pointed out, didn't she, that the procedure is just one part.
Absolutely. Treatment is one side of the coin. Adapting to and sticking with that healthier lifestyle, that's what ensures a long-term success and keeps the heart healthy going forward.
Okay. So as we kind of bring this deep dive toward a close, we've covered a lot. We've looked at the different types of heart diseases.
The whole spectrum.
Those crucial warning signs, the ones that are often subtle and easily missed.
The insidious ones.
And the big risk factors: diet, inactivity, smoking, genetics, stress.
Yeah, the whole package.
We've also unpacked prevention and the main pillars of treatment, including how far medical procedures have actually come.
Those advancements are really something.
It all really hammers home the power of acting early, doesn't it? And just being aware. So, okay, what does this all boil down to for you, the listener?
You know, I think the most powerful piece of advice comes straight from the patient himself, from Mr. John Anderson's experience.
What did he say?
His wisdom. It's quite poignant, actually. He basically said, listen to your body.
Yeah.
And don't ignore even mild symptoms.
Simple but profound.
Very. And then he added, make those healthier lifestyle choices early because prevention is easier than the cure.
That really says it all.
It does. And this isn't just about dodging a diagnosis.
Yeah.
Heart health is just so central to your overall wellness, vitality.
Right, it affects everything.
Everything.
Yeah.
And those small, consistent changes you make day to day, they really can add up to huge life-changing results. Not just for your heart, but for how you feel overall.
That's encouraging.
It is. And of course, the crucial reminder, if you do have any concerns, any worries at all about heart disease, the most important first step, always, always talk to a healthcare professional.
Absolutely. Don't guess, get checked.
Yeah.
Okay, so one final thought for everyone listening to take away and maybe mull over.
Okay.
What small, sustainable step, and I mean really small, maybe just a tiny shift in what you eat or adding one short walk to your day or even just taking, 60 seconds to consciously breathe and de-stress, what one small thing could you start doing today that might significantly boost your heart health and just your overall well-being for many years to come?